Hi, everyone. Welcome to the Billing Breakdown by Quelin Billing, the show where we dive into real issues impacting medical practice and revenue cycles and how you stay ahead. I'm your host, Amber, and today's episode, we're going to hit a nerve of a lot of providers and administrators out there. We're talking about the credentialing nightmares and specifically how you could be losing thousands of dollars a month and not even without even realizing it. Let's get in it. Let's get to it. So, we all know in the insurance world, credentialing is key. You need to be credentialed with a health plan in order to bill for certain payers. Uh, First, let's get real about what credentialing means. Credentialing is a process where providers, therapists, surgeons, anything in healthcare, not just healthcare, for medical, dental, vision, you all have to do it. Every healthcare provider out there, whatever your specialty is, you name it, you have to get approved by the insurance companies to treat patients and get paid for their services under the insurances. Sounds simple, right? Wrong. Sorry. Ooh, sorry. Hate to bust your bubble. Credentialing is more complicated. It is slow. In a lot of cases, it's broken. Let's be real. It's broke. If you don't know what you're doing, you can mess up a provider's practice and not even know it. If you're thinking we already did that when we hired Dr. Smith, Dr. Hugh. No, don't think about it. Not so fast. Slow down. Hold on. Even if you are working in a credentialing office, slow your roll. Let's break this down. Let's break this down. Here's where it's gonna get messy. Credentialing isn't set it and forget it. That's what a lot of people think this is. That's a lot of people think what credentialing is. You do it once, you don't have to do it again. No. I'm here to tell you. No. It has to be maintained, revalidated, and tracked constantly. This is a thing that never goes away. Just like your licensing. When you get certified in, let's say you're an MD, you graduate, you pass your board. Are you done? Really? Once you get your certification, are you done? Or do you have to continue trainings, recertifications, revalidations to keep your certifications accurate? Same process with credentialing. So if your providers aren't properly credentialed or their credentialing lapse, they don't get paid. You don't get paid, your practice don't get paid, your organization may not get paid on that provider. Or worse, you get paid and then have to pay the insurance back for audits if it's not done right. But don't worry, we're here to help you on this little nightmare. So let's talk about a hypothetical situation here. There's a multi-specialty clinic that I used to work with here, who we used to work with here at Quelin Billing. For privacy purposes, we're just gonna call them Healthy Horizons. That's their name. It might be a real practice out there named Healthy Horizons. Don't come for me, and we didn't work for you. It's just the name we're using. Um, they're a multi-specialty provider. They do primary care, infectious disease. That multi-specialty providers, infectious disease. So they did a lot of ST testing and stuff like that. So a lot of their providers, and they also offered behavioral health services. So it was a round health multi-specialty practice group. One of the problems when we went under contract with them is they were paying for a credentialing company, but they weren't getting paid right. What was going on? My company, we went in, did an analysis, gave them feedback. Then when we started deep diving, first thing we start with is credentialing. Why? I've worked in this industry for over 14 years, and I used to work for the insurances. Keep in mind, I used to work for the insurance companies. So and I know this, if your credentialing's messed up, you're not going to get paid right. If you're not renewing your credentialing every year, revalidating, doing those rates, you're not getting paid right. You may have been contracted for credentialing back here in 2015. You may still be getting paid at those rates from 2015. No, and those rates change. Every year the rates change. They don't just stay at one thing. So that's why credentialing is important. But back to this the Healthy Horizons here. They didn't know some of their providers weren't credentialed properly. Their group and practices were not credentialed for all lines of business. For United Healthcare, let's put it like that. United Healthcare, The reason why I say United Healthcare owns a lot of different health plans, lines of business, just too much to name. If you work in healthcare, you know. But they weren't credentialed properly. They were losing. There were claims saying they weren't credentialed or enrolled for that product, so they weren't getting paid. Went in, asked them the question. Of course, we didn't do their credentialing. We had to ask about their credentialer. They couldn't give the feedback, so ultimately we took it over. Went into it, found out they were only credentialed for the basics for under United Healthcare. Now, ladies and gentlemen, I'm going to tell you this. If you're paying a credentialing company or a person that says they know credentialing, they better know insurance, not just submitting paperwork. Because here's what's going to happen. And there's how, here in Quelin Billing, we make sure our clients are taken care of with their credentialing. When we go through the credentialing process, first we start with your application. Yes, we do that. Then when it talks about contracting, when they ask you what lines of business what services or what lines of business you want to be contracted with, you don't just say, HMO, PPO, EAP, whatever they give you. Don't do that. What you need to say, and this is for credentialers, if you're listening, if you're doing it for the provider or you're a provider and you want this, your credentialer person or your biller, whoever does your credentialing, to do it. You make sure that they say you want to be credentialed for all lines of business. What that means, all lines of business, is insurances, they roll out new health plans, new products every year, every quarter maybe. Well, in doing that, what's happening? Your patients, their plan may be this, now it's that. You may not be credentialed with that because you were credentialed with this. Don't be one of those providers, and I cannot count on my hand how many of those providers have dealt with that issue. Don't be one of them. Don't do that. So what we did, we ended up fixing their credentialing, because all it is, if you're already credentialed with the health plan, all it is a letterhead telling them what needs to be done. You want this done, and you sign it. So they're going to draft you a new contract and send it to you. So stating that you want to be credentialed for all lines of business under this health plan versus just the basics saves you time and gets you a lot of money. Save this Health Horizons a lot of time and help them with a lot of money. You want to know why? Credentialing was redone. We were able to backdate some certain things in credentialing. Not all of it now, some of it. We were able to get the rates updated to the current up to year rates. And every year you do this every year. You don't just do one and done. You make sure the contracts are correct, updated every year. I'm sorry. If you think it is, don't argue with me about it. Don't hit the comments talking nasty. I'm telling you what I know, because not only do I used to work for insurances, I'm also a CMS officer and a certified coder and a Medicaid specialist. Let's get on this. As a certified coder, we go through codings every year. You want to know what we see every year? The CPT codes and their prices. CPT codes and their prices. Diagnosis, changes. Credentialing. Now, is your coder going to know credentialing? No, let's be honest. But I do, because like I said, I've been doing this for a long time. But with my practice, we were able to go back, rebuild a lot of their what was considered lost revenue the previous year, and was able to increase that, decrease the denials by 40% and increase the revenue about 80%. And that spike, and the reason why I say 80 is because you got to think about it. They were losing 40% of the claims that were already billed. We stopped that. We got that down. We decreased it. They had about a good 60-70% losing money. They were still getting a lot of money. But they had a good high volume, over 50% in losing money. 40% drop that down by 40%. You get a good number. When we say increase by 80% volume in revenue, why would I say 80%? Because now you are credentialed for all lines of business for United Healthcare. Guess what? You're going to get more patients with these different plans under United Healthcare. It's a United Healthcare product. You don't know that, but you are now credentialed. They are now credentialed for that. And guess what? That's more bottom line. Claims are going through smoothly. process paid. You're seeing more, you're getting more clients, you're getting more volume, you're getting more revenue. Plus, plus, plus. Good. Do not think just because you are credentialed, you do the process once, you're done. And that's kind of a lot of providers that I deal with or I've seen, they will think, oh, credentialing's done. I don't need to do credentialing anymore once we're done. And then they love to fight in that question of, well, why do I need to keep doing credentialing? Do you like getting money? You know, I can't say this to the providers because it's kind of rude. But don't you like getting paid at the appropriate amount? Don't you like getting your practice the best revenue that you can? Then do it every year. Do it every year. Do it every quarter because you have to. That's not just me saying it. United Healthcare asks for attestation. Your CAQH is going to ask you to do attestation every 90 days. Do it. Do not hinder. I say 90 days. CAQH may give you a different timeline. I say do it every 90 days. Easy. Simple. Because you have to do United Healthcare every 90 days. Every quarter. Do it. When you do one, you do them all, you make sure you're good, and you set a time. If you have an outside biller that's doing this, and they have a credentialing process, make sure around October 1, your credentialer is automatically talking about rates for going into the next year. Where in 2025, it's never too late to start working on 2026, and it's never too late to start working on the rates for 2025, because we're about to hit May. Or we're rolling into May. Half the year is almost gone. Don't let it be another half of the year and you still are getting paid at rates from 2020 or 2015 or 2017 or whenever you set up your practice. Don't do that. Just keep it on the ball, keep it up, and keep it going. Why credentialing gets overlooked? So why does this keep happening? Why am my insurance saying I'm not credentialed? Why is the insurance telling you you're not credentialed, but you went through the credentialing process with that plan? Honestly, or what happens? You did credentialing and you never heard back. Honestly, it happens. You fall through the cracks. Credentialing falls through the cracks, ladies and gentlemen. I hate to say it. It happens. It may be on your credentialer side. It may be on the insurance, who's the person representative side. Hey, it ain't a computer processing your enrollment here. It's a live person. Things happen. Mistakes happen. It's not glamorous. It is a lot of paperwork, chasing signatures, dealing with bureaucracy. It is a pain in the butt. I'm going to tell you. We do it here at Quelin Billing. It is not fun, but we have a good process for it. It's often assigned to the wrong person, or the person it's assigned to is out on vacation. Now, if it is routed to, and this happens for the insurances, and this what brings frustration to providers on why they're not credentialed yet. Let me calm everybody down. Credentialing, like I said, is handled by a person. So let's say it is sent you. This is for Blue Cross Blue Shield of Florida. The credentialing department, it has been in the credentialing department, it's been assigned to Joanne. Well, Joanne's on maternity leave. She just left from maternity leave, and look, she just got work in the work queue. It'll probably sit there until she come back from maternity leave if it is not pulled out. If it is not brought to their attention that, hey, my application, where is it? Escalated to the insurances. It don't let that happen. You stay on the ball. You stay in the communication. If that person is gone, you get on the phone. You send an email with the main department. Get it done. Get it happen. There is no system to track expirations, renewals, or pending approvals across different payers. Now, here at Quelin Billing, we do utilize different credentialing software to help us track credentialing. Let's not get crazy here. We did start off using spreadsheets. They were nice. You can create formulas and track it if you know what you're doing. If you know how to use Excel, you can do it. But it's not sending you reminders unless you know how to sync it to your Outlook and you use smart sheet data sheets or something like that. What we do, we use credentialing software. So CrediApp, Clinic Spectrum, whatever credentialing software you have out there, Meditech, whatever system or whatever company offers credentialing software, utilize it. Don't knock it. It might be a little expensive depending on which one you use, but use it. Why? Because it can automate a lot of your processes. You haven't heard back from this insurance, it sends a reminder. You haven't you haven't heard from your doctor that you need documentation for, it'll send a reminder and make sure, because it's not checked off by the system, it hasn't received that document. Do not assume just because, even in a manual process, if you're doing it yourself and you're doing it manually, you're using spreadsheets, set yourself up to where your spreadsheets as a task on your calendar. Set that calendar up on in your whatever email system you're using. If it's Google, Outlook, Zoho, whatever email system you use your calendar. Create tasks with reminders that'll help you. Remember, I haven't got, let me check this. Check it once a week or check it bi-weekly, however you do it. Or check it every two or 3 days. Don't check it every day because you'll go cuckoo because you got other things you got to do. And then the biggest thing, everyone assumes it's taken care of. Oh God, I cannot. Oh God, come on now. I can't tell you how many people I deal with that say, oh, it's already done. And then you go and check and it's not done. I have a new couple of providers that we're onboarding. They're assuming it was done by their previous. They've been in business for a couple of years, a while. Go in, we're in the credentialing process right now. Find out they're not credentialed for what they think they are supposed to be credentialed for. Ooh, that's a good conversation. And you know the bad thing about that, if you have a new credentialer and they're going in and they're looking into it and they're telling you feedback, don't yell at them. Do not fuss and bite at them because they're doing their job. I know I have a couple of clients that got upset when I told them their credentialing weren't done right. And they got upset with me. And I can seriously tell them, well, it's not on me. I didn't do your credentialing. I want to tell them so bad. I didn't do this. You did it. You hired somebody. They didn't follow through. They told you it was done. It wasn't done. Don't chop my head off for someone else's mistakes. Don't chop anybody's head off for someone else's mistakes. Let's be honest with this. So don't assume it's done until you have it in your hands done. Don't assume. It's the same thing with insurance verification. Don't assume. Assumptions are the mother of all. You know the rest of that. Assumptions are the mother of all mess ups. Never assume, ladies and gentlemen. Never assume. Credentialing isn't just hiring a checklist team. It's ongoing. So you think you're hiring a credentialing person to do your credentialing, your new practice? Oh, I do them for 6 months and I'm done. No, darling. You need a credentialing. Once you are credentialed and you get fully credentialed, guess what? Every quarter, they need to be verifying your credentialing. Every quarter, they need to be making sure your attestations are done. They need to make sure you are good. Every quarter. And once a year, they need to make sure contracts are good. Going into the new year, make sure you're getting the right rates. Your contract says all lines of business, not just A, B, and C. Make sure you have all the alphabets in there. So don't just assume. And don't just think that, it's done. Until you have full confirmation it's done. With documentation. I say that documentation. I can't tell you how many providers that said it was done. And I was like, where's the contract? And they can't provide me the contract because it was never done. So in my mind, it wasn't done. So another section that goes around, and we kind of talked about it earlier, is the hidden revenue loss. Let's put some numbers to this. Come on, let's be real. Let's get this. So if you're a mid-sized practice, you have five providers, and even one of them loses credentialing with a major payer, Blue Cross Blue Shield. We're gonna talk about the major players. I've already talked about United Healthcare. Let's talk about Blue Cross Blue Shield. And everybody got Blue Cross Blue Shield. Don't joke yourselves. You could be losing anywhere between $50,000 to $100K a month, depending on your patient volume. Let that sink in. You could be losing $50,000 to $100,000 a month from one provider losing their credentialing's been messed up with Blue Cross Blue Shield. That's a lot. That's somebody's salary. That are a couple of people's salaries, or one person's salary, depending on what you do. Now, if you're a provider and you have a solo practice, put that to mind. You may be losing $5,000 to $10,000. Let's break it on down to a smaller one. $5,000 to $10,000 because your credentialing is messed up with Blue Cross Blue Shield or Aetna, United Healthcare, whoever. You're losing money. You're leaving money on the table. You're losing money because your credentialing is not done right. Let's be real. Your credentialing is not done right. You're losing money. Who wants to be losing money? In today's economy, nobody wants to be losing money. It's insane. And it's not just a direct loss to your cash flow disruption. While you're refiling the claims and appeals and all that, your administrative costs, because you still got to pay people. They payroll. You losing money, but people still got to be paid. Payroll got to be paid. You know what I mean? And damage to your patient's trust when they get those confusing phone calls. Because Lord, let's see what happens. Example, you got to pay your provider. Let's go back to this 5 providers clinic, multi-specialty. You have your financial department is calling one patient, a couple of your patients, because you got a claims that came back that says patient responsibility referral is needed, or providers not credentialed. Now it's laying on patient responsibility. Patients getting the call saying, they got to pay this X amount of money, larger than what their copay or core insurance would have possibly be, larger than $100. Let's go like that. Some people have deductibles, things like that. But they got to pay out of pocket now. You know what's going to happen? They're not going to pay. One, they're not going to pay you, and they're going to go to another doctor that they are in network with their insurance. They're going to call their insurance, get upset. The insurance is going to find out what's going on, tell them it's not their problem, and then they're going to go to another doctor that takes their insurance. You lose revenue. The patient has lost your trust, even though it doesn't matter how good of a provider you are, but your billing is messed up. They don't want to go to you. Your credentialing's off. Don't do that. Don't hurt your business. Don't hurt your practice. Even if you're a solo provider, don't hurt your practice. It's the classic, you don't know what you don't know situation until it's too late. And we all know that. You don't know what you don't know until it's too late, and you're losing thousands of dollars. You look at your books at the end of the year and you're like, I've lost over $250K or $250,000, depending on the size of your practice, what you do. I've lost $60,000. I could have used that $60,000. I wouldn't have to be struggling in paying my bills. Let that sink in. Numbers, money. Credentialing. Don't let it hurt you. All right. Enough of the hard stories, because I know that a lot of people are. If you're listening to this, you're like, oh no, Lord, I don't want to. This is too interesting, but I relate to this. Let's talk about some solutions here. Let's talk about the simple fix here, that can help you. But let's keep it serious. Back to serious now. Let's keep it real. It takes commitment. It takes understanding. Get a credentialing system. Get a system of credentialing. Now, you may not be using a software. You might be using Excel spreadsheets and your tasks, tabs in your Outlook. Create a system. Create a good system. What does that mean? One, you're going to centralize all credentialing data, every payer, expiration date, every approval letter, everything. Put that in the center. Excel spreadsheet, smart data sheets, whatever spreadsheet system you use, get it in the system. Put it in the system. Centralize all that data to where you're not looking through files trying to find it. It's on a spreadsheet. You got it right here. You can track it. It's good. Use a software. Even simple dashboards that track renewal dates, 120 days in advance are perfect. We use them here at Quelin Billing, and they help a lot. Trust me. Assign a dedicated credentialing manager or outsource to specialists. Now, when you outsource to specialists, make sure they know what they're doing. I'm not against credentialing companies or credentialing people. I just say that because in my company, I have credentialing specialists. I have credentialing managers. But guess what? The ball still starts back at the owner. Me. Right here. The ball still starts, and I make sure, I double check and I triple check, and I train my staff, even my credentialing manager, to make sure they fully understand. I don't care how it's been done. I understand you know the process of credentialing, but let me give you what you don't know. Everyone, you don't know everything. Let's be honest. You don't know everything. So don't take that if somebody's coming to you with additional information that you don't know. Don't be like, they're Mr. Know-it-all. No, they may just want to help you. Come on now. Let's be real. Set up the alerts. That's what we were talking about. No one renewals sneaks up on you. Set up your task reminders. Like I said, utilize your task manager. So what you can do, and you all know, if you don't know how to utilize your Google calendars, you can create a task. You can put a time clock on that task. That way when it comes, let's say you're credentialing in 90 days out, you've done credentialing, you're good, but you got to do it at a station for the new quarter. Put a 90-day reminder on that thing. Put a task on it, put a 90-day reminder. So when you open your email, and we all do, because we all utilize email, your tasks are loading up on you. You can use a task database like Monday or something like that. I'm not advertising. I'm just telling you some of the systems like we use. That when you log in, I use Outlook. We log in, tasks are low. When we open our email, tasks pop up right there, tells you what your tasks to do for that day. Reminders that are coming up due for that month, or the clock is timing. Put a clock on it, let you see. Audit monthly. Yes, I said monthly. Don't do this. To make sure there's no gaps forming. Make sure documentation you're getting documentation you need. Make sure the insurances have what they need. Make sure you're following up with the insurances, that they have everything, and you're not being left in the dust. You're not falling through the cracks. If you're credentialing, just audit it. Make sure, if you haven't heard back, let's say I haven't heard back from Superior Health Plan. I'm here in Texas, so I'm saying Superior Health Plan. I have not heard back from Superior Health Plan this month. I'm credentialing. They need to be reaching out to me, asking me for something. Either it's the license, the W-9. I need to be hearing from them. I haven't gotten a contract. What's going on? I've sent them data. It's been a couple of weeks. It's coming to the end of the month. What else do they need? Send a follow-up email. If you haven't heard by the end of that month, send a follow-up email. Trust me, it does wonders. Think of credentialing like a preventative maintenance on your car. You don't wait for the engine to explode to change your oil. Come on now. And some people might. Ain't no shame in you. But you don't. When the check engine light comes on in your vehicle, most people go see what that check engine light means. You hear noise in your car. You go see what it means. You go get your oil changed, and they give you a little sticker on your car telling you when you need to go get your car changed, the mileage, or the specific date if you don't drive your car too much. Don't wait till your car tells you it's time for an oil change that you need to do it. Because by that time, your car is telling you, hey, it's about time for your oil change. We right here, if your car tells you that. If you got an older car, you got to rely on the sticker. You know what to do with the dipstick, stuff like that. That's automotive. If you get proactive, you can avoid 95% of these revenue nightmares that happen across medical billing. Across the healthcare industry, in every single industry. Trust me, I know, you know what you're talking about. If you need it, you can reach out to us and help you walk through it, because medical billing is serious. Credentialing is the starting point, and credentialing can make or break your practice. So if you don't know where to do it, reach out to us here at Quelin Billing. We can help you. Even if you're a credentialing company and you want to learn some nice little tricks that the insurances don't tell you, because they're not going to tell you, speak to somebody that used to work for the insurance company. Speak to somebody that knows how to talk insurance a little bit better than what you think. Because a lot of people think this big fear of insurance is, oh my God, insurance is so confusing. Yeah, it is, until if you don't know what you're looking at, or if you don't know who you're talking to. I've worked for the insurance industries. I've trained my staff I've shared my knowledge to my staff. It doesn't hurt. I've shared my knowledge with other coders, other billers, other individuals in this industry, and it's helped them. It's helped them with their business. Now, you're going to ask, well, Amber, why are you helping another billing company, and you own a billing company? Look here. I'm going to tell you like this. This industry is too large you can try and monetize by yourself, because you're going to be a headache. It's going to give you a headache. I'm sorry to tell you. It is better to build connections and teach people the right way of how to do things. And you might not know it all. I don't know it all, but I know what I know, and what I know I can help you with it. Because I can't tell you how many coders and billers I done said we did roundtables, and come to find out they're billing the wrong code. They don't understand MUEs. We're talking about credentialing. They're saying, oh, my provider's saying they're not credentialed with this insurance. And I said, okay, but the biggest question, they're like, well, I called the insurance and it says they're credentialed. Okay. Then how about the next time you call the insurance, and this is for anybody out there, this is a good nugget. Rather than calling insurance asking, am I credentialed with United Healthcare? They're going to tell you yes because you're asking a basic question. They're going to give you a basic answer. When you call an insurance checking your credentialing, ask them, is Healthy Horizons credentialed with all lines of business for United Healthcare? What's the difference between am I credentialed with United Healthcare and am I credentialed with all lines of business with United Healthcare? If you're credentialed with United Healthcare, they're going to tell you, yeah, because you signed a contract, you're credentialed with United Healthcare. Saying the second one, am I credentialed with all lines of business? What that'll give you a specific answer on what plans and products you are credentialed with. And if you want to tell them you want to be credentialed with all lines of business, they'll tell you the process of what to do on how to change your contract for the verbiage. Now, once again, if you don't want to do that, if you don't know how to do that, or you don't have the time to do it, again, reach out to us. We can help you get that process and explain it to you. You can be a provider, you can be a credentialer, biller, whoever you are. If you work in healthcare and you want to know this to resolve your credentialing nightmare, reach out to us. We're not gonna turn you away. We'll give you the information that you need. So, a couple of things to circle back to when you're doing credentialing. A quick checklist. You're gonna audit your current credentialing status right now. Don't wait. If you're a credentialer, get started on your client's credentialing right now. Check the status. If you're waiting on it, check. Don't wait. Identify who's responsible and where they have time and the tools to manage it. Find the person that's supposed to be working on this. So if it's at your credentialer, see what's wrong. If it's at your biller, see what's wrong. If it's at the insurance and you haven't heard from them, and you go back and you search your emails and you haven't heard from them about 3-4 months, get on it immediately. Don't wait. Don't wait for them to hear back from you. Contact the general credentialing department so they can pull that application, because most types of it fall through the cracks. Buy or build a tracking system. Like I said, you can use Excel and your calendar tasks to create a good flow, or you can get a credentialing software. There's many out there. Utilize Google to find them. I'm not going to name them out here. Don't assume it's someone else's job. Let me say that again, because that's going to sink into somebody. Do not assume it's someone else's job when it's your money on the line. Doesn't matter if you work for an organization or you're a solo provider. When it comes to your credentialing, don't assume it's done because they said it's done. Show proof. Let them hand you that welcome packet. That's how you know it's done. With the start date and the effective date saying credentialing approved, do it. Don't assume it's been done because they tell you it's done, but can't give you confirmation. Or just because the contract is signed. Are you credentialed with all lines of business for those respective health plans? Don't assume it's done, and don't assume you are. Verify. Trust, but verify. That's going to save you. Credentialing isn't optional. It's the foundation where your revenue stands on. Don't just think, oh, you're a private. Now, if you're a private practice, this don't pertain to you at all, because you private pay. But for those that are not private pay, that are credentialing with Medicare, Medicaid, and all the commercial insurances, even TRICARE, military, credentialing stands. Credentialing is the starting point for you getting the maximum reimbursements, because that tells you how your contract is going to be written. That's going to put the rates and everything you're going to need in a contract. Don't just sleep on it and you focus on the billing. Don't focus on the billing. Focus on the credentialing. And if you don't have time to focus on credentialing, find somebody that can do it for you. Now, let's be honest. This credentialing is not going to be cheap. So you're going to have to think about what's more important. Now, if you start in your own practice, find someone that can work with you and you be upfront with them. I'm a new provider. I need help credentialing. You can do it yourself. Yeah, sure. But are you going to understand the verbiage and make sure you're credentialed with all contracts unless you have a consultant? Now, you can get a consultant, and what I mean by a consultant, and we do consultant services here as well, get someone that can double check. That's not their job is to make sure you submitted the work. Let them follow up for you. They're not doing the applications. They're making sure you've done your work. Let them follow up for you. But come on. Let's don't let it hinder. Don't let your money sit on the table. Now, if you don't know where to go, you're looking for credentialing companies, and trust me, there are that many out there. But you want a reliable credentialing company that can also help you with your billing. Reach out to us here at Quelin Billing. We can help you. We're a full service medical billing company. We start everything starts from provider credential services, from provider credentialing all the way to patient collections, denial management, AR management, anything. We everything around medical billing we'll take care of it. Because guess what? In the 14 years I've been doing this, I can tell you from my 14 years of experience, credentialing is the number one thing that'll make your practice run smoothly. Credentialing, insurance, authorizations. There are so many different pathways to success, and make sure your practice is bringing in the best revenue. So I want to thank you for tuning in for the billing breakdown. If today's episode gets you thinking, I need some help with my credentialing. Good. Oh, I need to recheck my credentialing. Good. Think that. This is what it's for. Take action now before credentialing costs you even more later. And if it's costing you now, get something to jump on it right away to turn your revenue around. Be sure to subscribe, share this episode with your team, and leave a review if you find it helpful. And hey, if you need help setting up your credentialing system that doesn't suck, we're here for you. Visit our website at Quelin Billing, www.quelinbilling.com. You can always reach out to us via email at contact@quelinbilling.com. Again, that's going to be contact@quelinbilling.com, and it is spelled QUELINBILLING.com. Until next time, stay credentialed and be safe. Talk to you later.